Dealing with any cancer is not easy, and post-cancer treatment hair loss or alopecia after chemotherapy is a real problem and faced by many who've had the chemotherapy or radiotherapy. Now, how to deal with it and what can you do to have your hair back after chemotherapy, we shall be discussing in this video. Now, let us understand why having chemotherapy causes hair loss. Chemotherapy generally targets rapidly dividing cells, and hair follicles also have rapidly dividing cells. That is why they get affected during the course of chemotherapy. However, when you talk about radiotherapy, what happens is that the effect is really local, and wherever radiotherapy is targeting, there the hair loss occurs. Unlike in chemotherapy, where hair loss is generally generalized. So they have different patterns of hair loss, chemotherapy and radiotherapy. Now let us understand when you will be experiencing hair loss post-chemotherapy. So generally in about 3 weeks from starting your chemotherapy, you will experience hair loss. But another question is whether all cancer treating drugs will cause hair loss? No, all drugs will not cause hair loss. Neither will all of the patients who are undergoing chemotherapy have hair loss. So you will need to understand the side effect profile of the drug that you are taking and whether that has the potential of hair loss. And many a times this hair loss is not common to all patients who are taking any particular drug. So what can you do early on to deal with the hair loss that you are going to face? We'll be discussing further in this video. Before that, let me tell you that you don't need to panic, and hair loss from chemotherapy is not permanent. Most often, it is a temporary phase that will last about 3 to 6 months post your last dosage of your drug. And after that, you will start experiencing hair regrowth. However, this regrowth may be patchy. You may still have different texture of hair. The color of the hair may be different. You may have a diffuse, sparsely thin hair. But yes, all this is a passing phase, and you generally start having your good hair back after about 1 year of your chemotherapy stoppage. Now let us look at what options do we have to have the hair growth in the most healthy manner after chemotherapy is stopped. So generally, the drugs that we prescribe or the medications or multivitamins that we prescribe in other forms of alopecia are not very useful in getting the hair back after post-chemotherapy. We usually prescribe directly acting lotions, for example, minoxidil or hair serums containing capexil and redensil. So these will help directly in the hair growth. Even having platelet-rich plasma therapy or growth factor concentrate therapy or mesotherapy, for example, will positively affect the hair growth post your cancer therapy. Some patients continue to have patchy hair growth or sparse hair growth in different parts of the scalp even after conservative therapy, and in them there are two options. We can do selective hair transplant, so we can pick up hairs from the good growth areas and we can cover the bald patches or the patchy areas. And we also have another option which is called scalp micropigmentation. Now these are pigments that are tattooed into the scalp which look like hair, and they can give you a good coverage even if you don't want to opt for a hair transplant right away. So obviously there are options of hair regrowth post your cancer therapy. Most of it anyways is temporary and you will definitely gain back your hair. But yes, those who are still disturbed by the patchiness or the sparseness or the thinness of the hair regrowth that they have attained, they definitely have other options like already mentioned in the video. Just a few words of caution before I end this video. Number one is that excessive use of minoxidil is likely to cause dryness, which is already experienced by post-chemotherapy patients. So excessive use should be avoided. Number two is that many patients resort to wearing of wig very early on after their chemotherapy. So in this case, again, the scalp can be adversely affected, it can be excessively dry, and your hair regrowth can be affected. So excessive usage of wig should not be there if you want to have your hair back. In my opinion, in your journey to defeat cancer, chemotherapy is a very important step. And small issues like alopecia, hair thinning and patchy hair growth should not affect you adversely because there are a lot of options available to have your hair regrowth back. If you have concerns about hair growth, hair loss, hair transplant, do not hesitate to ask them in the comment box below. I shall be very happy to answer them. Do subscribe to our channel SB Trichology and keep the notification bell on so that you can get notifications for the new videos. Thank you for watching.